Hi, my name is Catherine Campbell. I work for a company called Projectus Consulting. I'm making a short video today to mark a very important month, which is October. It's National Breast Cancer Awareness Month. I believe that this is a very, very important topic for all women and men to be very aware of. Breast cancer is one of the most popular and typical types of cancer in the UK. It does affect 1 in 8 women. Normally it affects women over the age of 50, however younger women can be affected by this terrible illness too. So it's very important to be aware of what we can do to be aware of the cancer. Also, I'm making this video because my mum is a survivor of breast cancer. She had it less than 10 years ago, so it's a topic that is very close to my heart. So I think it's very important that we are all aware of the signs and symptoms of breast cancer. So what are the signs and symptoms of breast cancer? So most breast lumps are actually not cancerous. However, it's very important to obviously have these checked. My advice is to check your breasts regularly. If you notice any change in size of either or both of your breasts or your nipples, it's very important to have this checked. If you do notice any form of a rash or any dimpling around the nipples, also is very, very important. A common area that can be a typical sign of breast cancer is actually under the armpit. So it's very important while checking your breasts in the shower to also check underneath in your armpit as well. Also, if you do get any secretion from your nipples also, it's very important that you make your doctor aware of this. So there are lots of different ways that we can notice whether we can be at risk for having breast cancer. So what are the causes of breast cancer? This is still to be decided. However, from previous studies that have gone on, there are a number of causes that can contribute to breast cancer. Some of these are age. As I mentioned, anyone over the age of 50 is at a little bit more risk for developing breast cancer. Also, if it runs in your family, so if there is a family history of breast cancer, in particular with your mother or your sister, I would definitely advise to check your breast very, very regularly. Also lifestyle, so diet, the amount of alcohol that you drink, smoking, it can all contribute to breast cancer as well. And there are also a previous history of benign lumps to the breast can also be very sensitive, so I would definitely have that checked moving forward should they appear. So should you be diagnosed with breast cancer, do not panic. There are a number of ways that can be treated to get over this terrible illness. First of all, we can do surgery, and obviously we've got some great hospitals with the NHS in the UK and internationally as well. The first being surgery, second really chemotherapy, and third being radiotherapy. There are lots of different ways that we can treat this to combat it, so please do not worry should you be proved positive for this illness. To conclude, I hope you've all learned something from this short video. I want you all to be very aware that October is a very important month, and if you do know somebody, whether that be a family member or a friend that is living with cancer, or even yourself, please do not be worried, please don't be scared. Have the support and the network of your family and friends to deal with it. There are, and as I mentioned, there are ways to overcome this. I'm personally a medical imaging recruiter within Projectus Consulting and specialise solely in radiotherapy, radiology and cardiology. So as I mentioned, this subject is a very close subject to my heart. So I wish you all the best, and I want you to be very aware, and on the 18th of October, please wear pink. Thank you.